In this module, we shift our focus from drugs that are administered intravenously to those that are administered by other routes. We will also introduce the term biopharmaceutics or kinetics. Up to now in the course, we have limited our discussion to drugs that are administered intravenously so that we could focus on the processes of distribution and elimination. But the vast majority of drugs are actually administered by extravascular routes that range from intramuscular to subcutaneous injections to a wide variety of different formulations that can be administered by mouth. In addition to being more convenient, this also opens up the possibility of manipulating the formulation to control the release and absorption of the drug. The term biopharmaceutics refers to the study of drug formulations and how they interact with the animal's anatomy and physiology to affect the rate and extent of drug absorption. This in turn affects the concentration of the drug achieved in the plasma and ultimately its efficacy. Factors related to drug formulation include the types of inert or inactive ingredients such as fillers, flavorings, solvents and excipients that go into making the formulation. They also include factors related to the manufacturing process, such as the size of the particles containing the drug that are included in the formulation, and the pressure used to compact the ingredients into pills, for example. Ultimately, the formulation determines the route by which the drug can be administered, which in turn presents the challenges that the drug has to overcome, for example, epithelial barriers and degrading enzymes, to be absorbed systemically. For this lecture, I've curated a number of excellent resources that discuss these factors in more depth. They are focused on human anatomy and physiology, but the principles can easily be applied to animals as well. But before you explore those resources, there are two main points I want to emphasize. The first is the difference between the plasma drug concentration time curve following intravenous administration compared to the curve following extravascular administration. Notice that because the drug is not administered directly into the venous blood and must first be absorbed from the site of administration, there is an initial phase when the rate of absorption is greater than the rate of elimination because there is a higher concentration of drug at the site of administration compared to the blood, and during this time the plasma drug concentration is rising. At some point, a maximum concentration, Cmax, is reached, after which the concentration begins to decline as drug leaves the body faster than it is being absorbed. The time after administration at which this peak concentration occurs is called Tmax. Notice that Cmax and Tmax vary depending on the rate of drug absorption. If the rate of absorption is high, Cmax is greater and occurs soon after administration. If the rate of absorption is low, Cmax is less and occurs later after administration. Sometimes absorption can be so slow that it limits the rate at which the drug can leave the body as well. This results in a less steep decline in drug concentrations and therefore a longer plasma half-life compared to if the drug had been given intravenously. This phenomenon is referred to as flip-flop kinetics. Another difference with extravascular administration is that often not 100% of the administered dose is absorbed into the central circulation, from which it can be distributed to the rest of the body. If a drug is administered intravascularly, we know that 100% of the dose has been deposited directly into the central circulation. However, if a drug is administered extravascularly, it must first be absorbed into the central circulation, and this is not always 100% of the administered dose. Particularly if the drug is administered per os, absorption may be too slow for the whole dose to be absorbed before it passes through the gastrointestinal tract and is eliminated in the feces. In addition, the drug may be degraded or destroyed in the gastrointestinal tract by bacteria and enzymes, or it may be eliminated by metabolism in the gut epithelium or liver before even reaching the central circulation. The term used for the percentage of the administered dose that is absorbed into the central circulation is bioavailability. We can measure the bioavailability of a drug by comparing the area under the plasma drug concentration time curve, or the AUC, following extravascular administration with the AUC following intravascular administration. This is because if clearance remains constant, and we can assume that generally if we're giving the drug to the same animal, the AUC is directly proportional to the dose. So if less than 100% of the administered dose is absorbed, the AUC will be proportionately lower compared to intravenous administration or any other route of administration that has a higher bioavailability. As you go through the resources for this lecture, take note of the factors that may alter the rate of absorption and/or the bioavailability.